Green Warrior, do you or someone you know suffer from diverticulosis, diverticulitis, rectal hemorrhoids, varicose veins, gallstones, appendicitis, kidney stones? The list goes on. Leaky gut. Today, Dr. Rogers will shed light on these ailments and their potential causes, offering insights into prevention and management and some reversal strategies too. Now, before we delve into the root causes of these conditions and learn how to optimize your health, I want to tell you to stay tuned for an announcement of a giveaway of Dr. Rogers' book called The Medical Reformation Vegan Renaissance Bible. And he was alluding to that just a few moments ago because of how he is dressed and how he cut his hair today in homage to his book. And we're going to talk more about the book later on. And I'm going to tell you all the details about how you can enter to win this book that Dr. Rogers is going to send to a lucky winner. So that's going to be exciting to talk about a little bit later. So I think what we're going to do is we're going to start with our true or false game.
It's time for True or False on Be Green with Amy Live. Answer true or false to Amy's questions in the comments below, and Amy will ask our guest for the expert answer.
Okay, Green Warrior. Well, as I talked about in the intro, there's a lot of different issues, medical issues that can come up with our topic of conversation. And let's see how they all are possibly related. True or false, degenerative scoliosis is primarily attributed to a lack of blood supply due to atherosclerosis. That's a tricky question. Dr. Rogers, you want to tell us about that?
Yeah, and the reason I'll make this point is that, see, a lot of things in medicine, they all revolve around money. Anybody tries to understand medicine based on logic, science, helping the patients, it'll never make any sense. And what I'm saying is whenever somebody gets a spine MRI, there always the focus is there a disc herniation or not? Does it look like it needs surgery? What I'm saying is the most common reason people have back pain in terms of like a biological organic cause is because they got lack of blood flow to their spine. One of the things I do is I'm a neuroradiologist as well as other things. And I used to run a spinal injection clinic, by the way. I got a lot of experience with back pain and I've seen tens of thousands of spine MRIs. The most common problem people have is a lack of blood flow to the spine. I actually developed the whole theory of spinal ischemic degenerative disease. There were some papers on it back in the 1980s, but I figured out that it's not just one little thing here and there. It's actually pretty much everything in the spine. With regard to it's not just degenerative disc disease. It's also DISH, diffuse idiopathic skeletal hyperostosis. It's also OPLL, ossification of the posterior longitudinal ligament. It's probably OLF as well, ossification of ligamentum flavum. And it also relates to interbody fusions. And it might even be related to Bastrup's disease with spinous process fusions. So anyways, we'll get into more. But so what happens is when you have ischemia of a lumbar artery, it can be asymmetric, more on the right side than the left side. And that can lead to failure of the disc on one side. So when you have failure of the disc on one side, the disc will lose height on one side, and that'll cause a tilt in the spine. So that's degenerative scoliosis. See it all the time.
Oh, my goodness. This whole topic is just fascinating to me because to think that this has to do with abdominal disease, that the back has to do with that, because obviously most doctors aren't aware of this. And of course, the patients aren't either. And to know that maybe something is in our control is very encouraging. So true or false, Green Warriors, patients with high meat diets are prone to developing kidney stones due to the acidity of the meat. Okay, Dr. Rogers?
Yeah, meat has a different amino acid composition than plant foods. It's got more sulfur-containing amino acids, cysteine, methionine, for example. And part of their metabolism is to be degraded into sulfuric acid, which causes a low-grade metabolic acidosis. And then part of the process is buffering, which takes calcium from the bone and from the muscles a little bit. And then simultaneously with excretion of hydrogen protons, the acid, the kidney helps manage acid base. Some calcium is excreted into the urine. So you get increased calciuria, calcium in the urine. And over time, if you have high calcium in the urine, it can start to precipitate in the kidney tubules. And you'll initially see little calcifications. They can coalesce and grow together and be bigger. That's kidney stones. I see tons of kidney stones. And it's the same patients. That's one little secret I'm going to talk about a little later is that same patients, they all have the same disease.
Well, that is just something that we're going to be very excited to learn more about, and you're going to go into even greater detail, and this is going to be helpful to a lot of people. And I hope that if you're watching, if you know somebody that is going through some of the things that we're going to be talking about today, if you'll tell them to hop on now and ask some questions, or you can always share the broadcast with them that they can watch it later on. True or false, caffeine consumption is linked to a higher incidence of kidney stones. See, now we are getting confounding information about caffeine. So straighten us out, Dr. Rogers.
Yeah, well, basically, any commercial product that generates a profit, a significant profit, it's always going to be surrounded by what I would call a bodyguard of lies. Industry's gotten smart. So they own the journals. It's such a joke that it's not like they just have an article published in there. They own the whole journal, and anything against their product will not ever be allowed to be published. And so what I'm saying is, caffeine is bad for health, but I know there's tons of publicity. So all this industry-funded publicity is going to tell you that caffeine is good for you, and soy is good for you, and F- in the water is good for you. It's all nonsense. And, the way you can get the truth on a lot of things is just go back in time before about 1980, and you just ask yourself, what does caffeine do? It increases, corticosteroids. It increases catecholamines, adrenaline, noradrenaline. And it's going to lead to increased electrolyte secretion in the urine. It's going to increase the risk of kidney stones.
Well, I'm glad you told us, because there's a lot of information that's confounding, and I really want the Green Warriors to get the truth here and to optimize their health. True or false, increased abdominal pressure due to straining during bowel movements can lead to varicose veins in the legs. What do you think, Green Warriors? Dr. Rogers, tell us about this.
Yeah, because, basically fiber pulls water into the stool, makes it more liquefied. A normal human bowel movement should be closer to being like a cow patty. Typical American is constipated, relatively speaking. They don't eat much fiber. They eat an average of about 12 grams a day when they should be eating more like around at least 50, if not 100. Okay, so they're popping out, goat pellets and Tootsie Rolls, so to speak. And they strain a little bit at defecation with what's called the Valsalva maneuver to tighten up the abdominal muscles. And that it creates back pressure into their abdomen. This is called abdominal pressure syndrome. It was described by Dennis Burkitt in the 1960s. So the downward pressure, when the abdominal pressure is increased, it pushes through, the veins run right through the abdomen, posterior abdomen, the inferior vena cava and the iliac veins. It puts downward pressure into the leg, and that promotes varicose veins. It actually does a whole bunch of other things we're going to talk about in a little while, but varicose veins is one of the things it causes.
Oh, my goodness. And I think about all the women that are having these procedures done to remove varicose veins, because they can apparently be pretty painful, as well as not very nice looking for women who are from the vanity perspective. And here they are getting these procedures done, but that's not what it is.
Yeah, I got something else funny about it, is none of the doctors know about this, because I get doctors that want to tag along with me for a couple hours for a day to learn from me and stuff. And I always ask them this question. I never met a single one in my life that knows this. I never met a single surgeon that knows this. Okay. So you would think a surgeon, a general surgeon, an abdominal surgeon, of all people would know this. And I'm sure that some do, but I've never met one. And I've asked a few. Okay. And I've asked a bunch of surgery residents. They don't know it. They'll think you're talking about abdominal compartment syndrome. That's a totally different ball of wax, an acute setting in the emergency room where you can measure abdominal pressure with a Foley catheter. That's a different situation. I'm talking about everyday abdominal pressure syndrome Dennis Burkitt described back in the 1960s. And that's what I mean is, that's another point. Like, what was the point of this book? Let me tell you what the whole point of this book was. I've rewritten all the medical textbooks because they're all stupid. All right. When I say the medical textbooks are stupid, you say, well, what am I talking? Who am I to say that? And I'll tell you what that's all about. Basically, you've got surgical textbook, and a surgeon is a man on a mission. Basically, you want to take the appendix out. There's 50 steps you have to do, and you will remove that appendix. So it's pretty logical. Okay. Surgery literature is straightforward. By the way, I was an imaging guided surgeon before I switched to being a neuroradiologist primarily. I've done thousands and thousands of surgical procedures. All right. So the next one is, let's say you talk about radiology literature. Okay. You'll say, okay, this is a stroke by definition, an acute stroke, a subacute stroke, a chronic stroke. For example, it's all logical. It's all described. There's nothing complex or mysterious about it. And the same thing with pathology. You look under a microscope, This is a benign normal cell. This is a cancer cell. Okay, the reason I go through all that is when you get to the internal medicine literature, it's a joke. It's a joke. Internal medicine literature is like mysticism and nonsense. Here's a typical, all the chapters tend to be the same thing. Here's what they say. This disease is not well understood. It is associated with aging. It seems to be in part, at least in part, genetic. No one really knows the cause. We recommend that you just take our pill and try to slow it down. And that's absolutely stupid because lots of these diseases, we know exactly what causes them. And there is a treatment, there is a cure, there is a way to prevent them. And this will never get into the literature, even if it was figured out 100 years ago. And so what I'm basically saying is the internal medicine textbooks, as well as the internal medicine subspecialties, which is a lot of subspecialties like endocrine and a whole bunch of other ones, their books are all a joke. They're basically drug dealing manuals.
It all, when you explain these things, they're just so the explanations are so logical, and it just makes so much sense. I remember seeing someone blowing up a balloon, or seeing a kink in a garden hose, and you just think about that's what's going on. Just changing the pressure, it's going to have an effect somewhere else. And so when you change the pressure in the body, it's going to have to get relieved somewhere, and it's going to have to push out somewhere. And this is just so fascinating. I'm so grateful that you're sharing all this with us today. And I know a lot of people are suffering with the things like fatty liver and appendicitis and things like that. And they're all going to be asking questions today because we really need some answers. And this is not something that we're getting from the medical profession for the most part. So true or false, high-fat diets lead to a higher incidence of appendicitis? Dr. Rogers?
Yeah, in general, that's true because a high-fat diet typically implies that it's low in fiber. Okay, high-fat diet usually implies meat and oils. Processed foods are very low in fiber. Meat has 0 fiber. So when you don't have any fiber, what's happening is the stool is relatively dry on the right side of the colon. The appendix, so imagine my fist, if you will, is the cecum. That's the beginning of the ascending colon. And my little pinky hanging down, that is the appendix. Well, you'll form a stone right in the top of the appendix right here. It's called an appendicolith. Appendo for appendix, and lith means stone. You'll also call them a fecalith. It means a stone made out of poop, feces. All right, so the stone will occlude the appendix at this level. The mucus-secreting glands down at the bottom will continue to secrete mucus, but they can't get past the stone. So the appendix will swell in size until it pops. That's appendicitis. And yes, meat eaters, processed food eaters, on the right side of the colon is dry for them.
Oh, my goodness. Well, this is just so fascinating, and we're getting a lot of comments here. People are very fascinated by this topic. True or false, a beer belly is actually an estrogen belly?
Yeah, basically that's what I think is funny. Like a lot of guys, they think drinking beer is cool, and getting drunk is cool, and they think having a beer belly is funny. In reality, it's really stupid, And they don't look like a macho man with a beer belly. They look like a pregnant female, okay? And they got high estrogenic hormones, and they get man boobs, moobs. And it's not just, I've seen these man boobs on CAT scans. They're not just fat. There's also there's also breast tissue development there. The word for that is gynecomastia. And you can get something called zearalenone in your beer and in your hops and stuff, your moldy grains, and they can also contribute to it. It's also stupid. I actually think drinking alcohol is totally stupid. All that stuff about it being cardioprotective, it's not true. And then on top of it, it's a major brain neurotoxin. I'm very interested in trying to optimize academic, intellectual ability and performance. So the last thing in the world I would do is be drinking alcohol. I mean, to me, that's like, oh, we got so stoned. You poisoned your brain. What's cool about that? It's just stupid.
Yeah, I guess they call it intoxicated because it's full of toxins, and people don't put those two together. And they're, again, confounding information. There are doctors that are promoting consuming wine as a health promoting. It's not, obviously. And this information is just so useful. Thank you. True or false, increased levels of estrogen in the body lead to a higher risk of breast and uterine cancers in women?
Yeah, the estrogenic chemicals, they'll stimulate proliferation of the breast, ductal cells as well as uterine lining cells. Estrogen goes up when a woman's pregnant, so then she starts making more milk towards the end of her pregnancy, gets hypertrophy of the uterine lining. So there's the estrogen chemicals themselves, which get elevated pretty routinely in Western women, but it's also estrogenic chemicals. That's a secondary issue of estrogenic, mean estrogen-like, but not exactly the same as estrogen. But they're both bad for her health, and there's a whole bunch of them.
And so many women are dealing with this, and they're getting procedures and pills, and they don't know anything else, and apparently their doctors don't either. True or false, lack of glucose delivery to the intervertebral disc can cause them to dry out, crack, and potentially herniate.
Yeah, so basically the outer part of a disc, imagine this is a disc, and the outer part is called the annulus fibrosus, like a steel-belted radial tire, whereas the center of the disc, of the vertebral disc between the vertebrae and the spine, it's like a jelly donut. And so when you have ischemia, lack of blood supply to the outer layer, it'll crack, and then you can get herniation, so to speak, of the jelly donut component through the crack. I have a picture of it. It'll be easier to understand once we get to the picture. But yeah, that's basically a relatively early event in spinal degenerative disc disease. And by the way, it's the most common thing I see in the spine. And I can tell you a lot of older patients in the United States over 70, they have degenerative disc disease at every single level in their lumbar spine and at most of the levels in their cervical spine. It's super common. And it's an irreversible event for the most part. And what I'm trying to say is the smart thing to do is just stop the progression of it, which you do by optimizing blood supply to your spine, because otherwise it just leads to like this inexorable process where it just keeps going to every single level. It works its way from the sacrum up to the skull. And the only way to, prevent it is the things I'm talking about. Get good blood supply to the spine, do things to optimize your body weight so you're not carrying all this extra weight, putting more stress on the disc for no reason. Yeah, we'll talk about it more when I have the pictures, but sort of like, what's the good news, what's the bad news? So the bad news is most Western people, they're not just a little sick, they're sick in, 20, 30 different ways. But what's the good news? They're pretty much sick all for the same reasons. And so once you fix the problem, you can make everything improved.
Yes, very good. That's very encouraging. True or false, a lack of dietary fiber can lead to leaky gut syndrome, which is linked to autoimmune diseases. Dr. Rogers?
Yeah, and this is another reason too. So basically the things we just talked about, ischemic spinal degeneration. You'll never meet a doctor in your life probably that's aware of that or has even heard of it. Okay, leaky gut. If you look at the chapters in the big pathology textbook coming out of the Ivy League, okay, Harvard and whatnot, they're an absolute joke. They won't even mention leaky gut in the entire chapter on autoimmune disease. It's the most common cause of autoimmune disease. Okay, ischemia, lack of blood supply, is the most common cause of spinal degeneration. Okay, that whole stuff about the calcium and whatnot causing osteoporosis, it's the main thing associated with osteoporosis. So what I'm trying to say is the most common causes of the most common diseases are not in the books. All right. And there's three big subjects I think are the cornerstones of health. There's nutrition, there's epidemiology, and there's toxicology. Those are the three most important things. Doctors are not trained in that at all. So what I'm basically saying is conventional medicine, to a large extent, for chronic disease, it's illegitimate because they don't know the diseases. They really don't. They're really not equipped to take care of them. All of the focus is on selling drugs. And that's why I'm saying, too, anybody who just studies this, with a health coach and studies it on their own on the internet will learn more than a doctor does in 12 years. And I realize that sounds ridiculous, but I can assure you it's 100% true, because I have doctors follow me around, medical students in their fourth year. I have senior residents, fellows. People come sometimes to rotate with me, sometimes to spend time with me, ask me questions. They never know the answers to these questions. It's not like they sometimes don't know. It's not like 50% of them don't know. It's like 99.99999% of them don't know. It's basic stuff. What's abdominal pressure syndrome? Okay. Explain to me estrogen metabolism and why do people in the Western world have high estrogen levels? They won't know these simple basic things. Actually, out of all these questions, I can only think of one resident got one question right about estrogen, and that was because she was going into OB-GYN, okay? The rest of them don't know any of this stuff.
Well, I think a lot of my green warriors can attest to it, because many of us have tried to, not at this level, but have tried to share some of this information with our primary care physicians or even some of our specialists, and they really don't know this. And here you wrote this book, and which we're going to be talking about a giveaway for a little bit later on, and maybe whoever wins this or whoever decides to get a copy of their own will share it or at least show it to their physician. It would be interesting to see. That's what I'm planning on doing, because I want to see what happens. It's going to be very interesting to see that. Okay, true or false? A diet high in processed foods and low in fiber can contribute to estrogen dominance in both men and women. Dr. Rogers?
Yeah, that tends to be a high-fat diet. And a lot of women in the Western world, it's real common. They're estrogen overloaded. Men too, but for the women, it's even higher consequences. When a woman's pregnant, she'll get real high estrogen levels. So what is a birth control pill? Typically something like ethinyl estradiol, EE2, estrogen-like chemical, and it'll suppress ovulation. It sort of goes up in pregnancy. It's a fat storage hormone. It's like telling our body, gain some weight, store some fat. The baby might need it for energy later. So there's a tremendous increased incidence of infertility in American women. Plus, infertility is not just common already. It's going up, up, up and away, okay? I actually think there's going to be tons of women that are not able to have a baby. I think it's going to be a huge percentage of women. Let's say a woman 20 years old right now, I'm going to bet you a Westerner, about half of them won't be able to have a baby, okay? It's off the charts how common infertility is now, and it's going to continue to increase. Let's see, what else is interesting? Oh, the same estrogenic chemicals that are high in their blood, they're increasing the risk of breast cancer. I'll talk about that during the talk, but what I'm basically saying here is, when a lady gets breast cancer, her friends show up, they want to be supportive, they typically run around with a pink ribbon saying we're raising money for breast cancer, and they mean well, okay, their heart's in the right place. But the whole thing's a bit of a joke because they're just raising money to give the chemotherapy company. They're not doing anything to empower themselves, and it's pretty simple. I mean, the basics of breast cancer are pretty simple. For example, you got aluminum metalloestrogen plugs up sweat pores. Okay, so all the deodorants are going to have aluminum in it. Plus, the typical preservative is like a parabenzoic acid, another estrogenic chemical. And what does a typical woman do? She shaves her armpits and she puts deodorant on every morning. It's totally stupid. You got shared lymphatics between the armpit and the upper outer quadrant of the breast. And basically, upper outer quadrant breast cancer used to be about 30% of breast cancer. Now it's a little bit bigger than the other quadrants. Now it's about 60% of breast cancer. And so that's thought to be the main association with it. Philippa Darbra, PhD lady out of England, is the one who did most to figure that out. And there's a whole bunch of other things. There's a lot of estrogenic chemicals in your tap water, including other women's birth control pills. EE2, they void it out in their urine, and then it goes into your water. And you say, well, why doesn't municipal water filtration remove it? And because it's too expensive to carbon filter all the water, so they don't remove it. So you got birth control in your tap water. That's why you want to have at least a carbon water filter in your home. And there's a whole bunch of other estrogenic chemicals in the tap water as well. And then there's a whole issue of how I think I have a slide of it. I'll go over it when I get to my slide of it.
Okay, well, at least you're giving us bad news, but you're also giving us action items to consider, and that's very encouraging.
Oh yeah, I'm actually going to tell you, I think all of this stuff is easy to prevent. You just simply have to learn a few things, and that's why I think all this nutrition and health stuff is so valuable, because you can very quickly learn how to prevent almost all of these problems. And people who come from traditional cultures where they don't do these things, they have hardly any breast cancer. It's almost so insignificant you wouldn't even know about it. Same thing with almost no prostate cancer. Same things that cause breast cancer cause prostate cancer. So for men should be paying attention because it's a big deal for them as well.
Oh, yes. And speaking of men, prostate enlargement in men, true or false, can be attributed to high levels of estrogenic chemicals in the environment and diet. Dr. Rogers?
Yep. So, typical guy, the first step you have to do is you have to start to realize it's dependent on you. It's not your doctor. Your doctor's not going to save you. You need to learn how to save yourself. And it's actually pretty easy to dramatically lower your risk of all this stuff. What the typical sort of stupid chump does is they're like, well, I'm going to do something proactive. I'm going to test all these things. And they go get their PSA test, prostate-specific antigen in their blood. It comes back a little elevated. So, in medicine, doctors are always going to be chicken shits. They're always scared. Well, his PSA is up. It's only up a little bit. It's probably a false positive, but just in case, we better do a biopsy. Okay. So then you're going to have 12 giant needles stuck up your butt, a sextant biopsy. bilateral upper quadrants, or bilateral middle level and bilateral lower pole. Okay, and you could potentially, become impotent from that. It's certainly not pleasant. It can be very painful. And so what I would do is, just by minimizing your estrogenic exposures, your risk is so low, in my opinion, I would never screen for PSA. I know my risk is next to nothing. So why would I risk having all the side effects and problems from it? So I wouldn't even check my PSA. I don't want to know it. Because if your risk is so low, then your pretest probability of having a complication is more likely than having a benefit. So you can avoid all this stuff.
Right. Just assume that you have all the genes that are bad and all the predispositions and that your poor diet from now until before when you started has done damage. Just assume it is and clean it up now and just move forward and try to, and in my opinion, people should be 100% cleaning up their diet and their exposures to chemicals and things, not just having cheat days and things, because we really, the older we are, we really can't afford the cheat days. Okay, true or false, the development of esophageal cancer is primarily linked to chronic gastroesophageal reflux disease, which is known as GERD, caused by abdominal pressure. Okay.
Yeah, because basically when you strain at defecation, the dry stool, you're going to tighten your abdominal muscle. It's called the Valsalva maneuver. And it also pushes your stomach up into your chest a little. So you get a hiatal hernia. We call it a HH. Okay, and that will tend to have gastroesophageal reflux. And the acidity of that will damage the lining over time. It typically is called initially a Barrett's esophagus, and it gradually can progress esophageal cancer. Back when I was a young guy, typical cancer, smoker-drinker cancer, squamous cell cancer. Now more commonly it's an adenocarcinoma type of cell type that becomes cancerous. And so, smart move is just eat the plant foods. You get the fiber, and you won't be constipated anymore. You won't have so much back pressure. You'll decrease your risk dramatically of that. Plus, you'll have better blood supply to the tissue. You'll be less likely to have ischemic esophagus or everywhere else in your body. Ischemia, lack of blood supply, can push you into what's called a Warburg effect, meaning tissue hypoxia. More than 30-35%. Cells can transform into cancer, become like an anaerobic bacteria. We have primitive pathways that can be reactivated, like anaerobic glycolysis. Otto Warburg was a Nobel Prize-winning biochemist from Germany. In 1931, he won the Nobel Prize, and he did this cancer research. He basically found that tissue culture cells will transform themselves into becoming like anaerobic bacteria, running on these primitive pathways, reactivating them to run on anaerobic glycolysis rather than using oxidative phosphorylation in the mitochondria. So the bottom line is, I would say people got, American Westerners, they got TBI, total body ischemia, poor blood supply everywhere in their body, because atherosclerosis, it's a diffuse disease. It's everywhere in your body. And so it's easy to prevent it, though. Stop eating high-fat diet. It's not rocket science.
I'm glad that you talked about that, because I so often think about people who get a stent and they think, oh, okay, it's fixed. Now I'm good. I'm golden, right? Or maybe they get 3 or 4 or 8 stents and they're like, okay, I'm good now. Everything's clear. And it's all over the body in places that you can't reach.
Yeah, stent, you have a heart. Imagine this. Imagine these ear protectors are your heart, okay? And on top of it, you'll have an artery. Imagine this is the left anterior descending coronary artery, okay? You could put a stent in the proximal part of it and reopen a blockage. But those types of blockages tend to be chronic atherosclerosis that is relatively fibrous. It's not the type that ruptures as a vulnerable plaque that's going to kill you. So the stents cause no improvement in all-cause mortality. They really don't. All they can do is relieve, let's say, some exercise-induced chest pain, dyspnea on exertion, shortness of breath. But you can't. And also, once you've got this big artery, you're going to have all kinds of distal little branches. Then you're going to have all these penetrating branches that go into the heart themselves. They go through the heart muscle. Those are intramyocardial branches. Myocardium is like the muscle of the heart. And what I'm saying is you can't fix those. You can't touch those with a stent. You can't touch the real distal stuff either. Stents are too big and bulky. So the vulnerable plaques, you can't even see them on a cardiac cath or a CT arteriogram. So they can't fix the thing that's going to kill you. They can't identify the incipient plaque that is going to become a vulnerable plaque rupture and thrombose, all right? So it's kind of, in my opinion, a bit of a big joke, okay? But, you treat a patient with meds, it's like you make them into a cow, and the system milks them every day as they have to give their money for the pills, all right? You pop a stent in, you get about $30,000 bucks, a lot of money for the hospital. If you do open heart surgery, a CABG, coronary artery bypass graft, you get about $150,000 for the hospital. That's a ton of money. So the people who run a hospital, they're always going to want more open heart surgery. For a lot of private practice hospital, that's most of the money they make. Over half of it will come from those surgeries. So some places it gets up higher, around 70, 80, 90% of their money comes in from open heart surgery and stenting. Okay, it's giant money. So what I'm trying to say is, somebody who runs a hospital for profit based on those principles, they're always going to want to do this stuff. And I've made the point too, and when some people say, oh, they'll criticize me, oh, I shouldn't say what I'm about to say, but I'm going to say it because it's true. You need to go back to Bible ethics or you can never fix medicine. The reason is, for teaching a person about vegan diet, how to prevent coronary artery disease, tons of research has been done on this, Esselstyn's diet and others. But you'll get almost nothing for that, or nothing. An internal medicine doctor is paid nothing to talk to you about that. There's always a bean counter in every clinic and every hospital who's cracking the whip on the doctors. Doctors are sort of like these highly educated slaves in a sense, that they have to generate a bunch of billing codes every day or they get in trouble. All right. Because what happens is the bean counter for the clinic, for the hospital, is always going to say, look, we got 5 doctors in our group. These other doctors over here, they're all seeing 30 patients a day. How come you only saw 15 patients a day last week? What is with you? You're too slow. You're lazy. You're slacking off. You're not pulling your weight. You either see 30 patients or we're letting you go. Okay, that's it. So what I'm trying to say is, they have to go as fast as they can, and they have to prescribe medications. Pharmacy makes money off of that too. The insurance company's happy with it. There's a standard of care. They can't get in trouble when they follow the standard of care, even if the patient dies. What happens to the patient's irrelevant. It doesn't matter. Okay, the patient could be a robot or something. It really doesn't matter. As long as they follow the standard of care, they can't get in trouble regardless of what happens to the patient. So what I'm trying to say is, all of the incentive and reward comes from follow the standard of care and go as fast as possible. There's zero incentive to spend any time with that patient. The less time you spend with them, the faster you can get your 30 patients for the day, and you get the bean counter off your case, okay? And you keep your job security. So, and the other thing is, no hospital, I've never seen a hospital or a clinic in my life that actually follows outcomes other than some small special research groups here and there. Because if they did, the plant-based diet would be so far superior to drug treatment that it would be an embarrassment. So you can bet the big pharma and the insurance companies, they don't want that happening because they're making tons of money, billions of dollars. Do you think they want people getting better with a low-fat vegan diet? I'm a low-fat vegan. I'm 60 years old. I don't have any medical problems. I don't go to the doctor. I don't take any pills. They think they want other people to be like that? No. They want the typical, when you say the word 60-year-old patient, I don't even have to look at them. I don't look at the chart. If another doctor tells me 60-year-old patient, I automatically assume the guy is pre-diabetic or diabetic. I automatically assume that he's fat. He's got coronary artery disease. He's impotent. He's got GERD. He's mentally slow. That's all guaranteed. That's why doctors talk so slow too. Hello, yes, nice to meet you. Because the majority of their patients are cognitively slow, okay? So until proven otherwise, they make the assumption the patient will be cognitively slow. I can tell you, my internal medicine friends will tell me every single one of their patients over 60 is cognitively slow. That's a very common thing in Americans. They're just, they're coming a little bit cow-like. It's because they got a lack of blood supply to their brain. Not to mention all the toxins ingested in their brain.
Oh my goodness. Well, we don't want to be cognitively slow, and we want to learn a lot more about all this. And you have a presentation that you have brought with you today to share with us. And while you get that up and running on the screen, I'm going to talk to our Green Warriors about the exciting news that I talked about earlier. And that is that there is a book giveaway. That's right. So Dr. Rogers has this book called the Medical Reformation Vegan Renaissance Bible. And this is you're going to have up to 6 chances to win this book giveaway and enter the book giveaway so that you could try to win. And Dr. Rogers has revolutionized medical literature, exposing the root causes of widespread diseases and advocating for prevention over conventional treatment. From debunking common misconceptions about obesity to unveiling theories on hypertension and atherosclerosis, this book is a game changer. So you or your physician can learn about toxins in food, water, and personal care products, and discover how to safeguard your health against modern day pitfalls. So please don't miss your chance to win a copy and embark on a journey toward optimal well-being. For those of you that follow me on begreenwithamy.com, Facebook, Instagram, and YouTube, you probably already have the information about this book giveaway. I'll also be putting the details in the show notes. And if you don't see it, just send me a message or make a comment and I will share that with you. And I'm also going to try to share it at the end of the broadcast as well. So Dr. Rogers, did you click on present? So
Okay, yeah. I'm on present. I'm ready to go. Here's my presentation.
Okay, well, I don't see it yet.
What I need to do is I need to share. I need to share it.
Share it.
Okay, so let me look in where's the share
So
button?
Green Warriors, do you know of anybody that has any of these diseases that we've been talking about today? Or if you have any questions, if maybe you're suffering with some of these things, if you have any questions about it, please go ahead and type that in the comments, because I'm going to be asking Dr. Rogers later on in the broadcast about this.
Can you see my slides now?
Not yet. So you'll just
because what I want to do is share my screen. I know I've done this
and
before.
then select
Where's the button to share screen? I hit present.
And then you can go down to
share screen. I get it now. I get it. Share screen. All right. So select window or screen. Presenting.
So Warriors, today we're talking about
okay, now it should be shown.
Oh, here we go. Okay, so we are going to let Dr. Rogers share his screen.
Okay, so here's looking at the abdomen, a frontal view. Here's the diaphragm right here. First thing we notice is usually we get the bottom of the heart. This is basically, I'm showing you what do we see on a typical CAT scan of the abdomen. We get the lower part of the heart, and you'll routinely see calcifications in the coronary artery disease. The coronary artery is related to atherosclerosis. The liver is almost always fatty because most middle-aged and older Americans have fatty liver. Okay, the most common reason I see they don't have fatty liver is because they got cirrhosis, end-stage fibrosis of the liver, either due to alcohol or more commonly due to NASH, due to fatty liver, advanced fatty liver. Okay, I'll often see fatty pancreas, which is accumulation in the pancreas, fatty atrophy that's associated with type 2 diabetes. As the pancreas accumulates more fat, the beta cells tend to fail. So that's a very characteristic finding of type 2 diabetes. Okay, I'll have another slide that's better when I'll go into the varicose veins, varicoceles in the scrotum, rectal hemorrhoids here. Also super common gallstones. 95% of gallstones are cholesterol gallstones. So the high-fat diet is predisposed to the cholesterol precipitating out of the bile and forming stones within the gallbladder. Okay, now here's an example of degenerative scoliosis. You got the abdominal aorta. AAA, AAA means abdominal aortic aneurysm. Most of the time, the aneurysms are pretty small, so not that many people die from abdominal aortic aneurysm. Yeah, it does sometimes happen, but it's super rare. Okay, so I would not put your fears. People hear the word aneurysm and they freak out. It's like saying a shark attack. Okay, but it almost never happens that somebody actually ruptures an abdominal aneurysm. What does happen all day long is they'll stenose and occlude the vessels that come off the aorta. And let's say you fail, like right here, you fail the left lumbar artery. The way you can know what's left and right is always imagine the patient's feet are facing towards you. So this would be the patient's right side. If you walked into the room and they're on the CAT scan table, their feet would be facing towards you. So this would be the right side, this would be the left side. So you can see you got more narrowing on the left side of this disc space, and that's consistent with the lumbar artery on this side being occluded or stenosed, narrowed, and this side of the disc failing, so you have a loss of disc space height. Disc space height should be closer to this level right here between the two vertebral bodies. By the way, two vertebrae adjacent with the intervening disc, that's called a spinal segment. So you can see you've got asymmetric disc failure at this level, and it's relatively symmetric at the other levels. This is gaseous disc degeneration. Notice at pretty much almost every lumbar level. So this is S1, L5, L4, L3, L2. L2 through S1, all moderate to severe degenerative disc disease. All right. And you got probably mild narrowing at L1, 2. All right. Well, anyways, we're going to come back to the spine a little later, but I'm just showing them it's routine to see the spine looking like that. And this is all irreversible stuff. So you want to get your act together, the sooner the better, before you have less irreversible disease. Okay. What else? Same high fat diets, high meat are typically meat diets associated with increased kidney stone formation. So here's a kidney stone forming in the calyx of the lower pole of the left kidney. Now, this stone will sometimes break apart and become dislodged, and it'll float into the ureter. It'll often occlude right here. This is called the renal pelvis. This is the ureter. So this is the UPJ, ureter pelvis junction. Common spot for stones to lodge. Or the stone will go further distal in the ureter, and it'll often lodge as well at the right posterior to the bladder. The bladder is called the vesicle. So that's the UVJ, ureterovesical junction, UVJ stones. If it's, more than, if it's 6 millimeters or less, they'll often pass it. If it's bigger than that, they'll often need urology doctor to remove the stone. I see tons of stones. I see them every day. It's not uncommon. I see them over a centimeter, and that requires a special procedure, percutaneous nephrolithotomy, to remove them. So all I can tell you is what it usually does. There's some other things that can be done too. They're super common. Okay, so that is some of the common stuff in the abdomen. Okay, now we're going to get into the Dennis Burkitt paper. This is abdominal pressure syndrome. So we talked about the appendicle lift. So dried out stool forming a little rock. Appendicle lift, you can also call it a fecal lift. It obstructs the appendix. This is the appendix, a finger-like appendage coming from the right side of the colon. This is called the cecum. It's the bottom of the right colon, or the ascending colon, as the stool travels in this direction. And when that occludes the appendix proximally at its junction with the cecum, and mucus glands in the distal appendix continue to secrete their mucus, and they can't get past the fecal lift, so they then will cause the appendix to swell and burst. And then when it bursts, you leak stool into the abdomen. That causes a lot of inflammation. That's appendicitis. I've had appendicitis perforations where I've had to drain 7 abdominal abscesses. Patients can die from that as well. All right. Here is diverticulosis. So basically, straining at stool defecation with the Valsalva maneuver causes back pressure, and it'll cause outpouchings of the wall of the sigmoid colon. And that's diverticulosis, super common in the Western world. I can tell you the majority of the patients that are middle-aged and older have this in the USA. I've had friends that come from other countries where they eat lots of dietary fiber, and they tell me we don't ever see, almost virtually never see diverticulosis on our CTs of the abdomen in those countries. So again, same thing, when a diverticulum in the sigmoid colon pops, you can leak stool into the mesenteric fat, the abdominal fat, and that can be very, very painful. And in a Western hospital, every single one of them, Western hospital in the world, is going to admit at least one patient, if not multiple patients, for diverticulitis every week. It's really common. The back pressure also can push down on, find a weakness in the fascia of the, the fibrous layers of the abdominal cavity, peritoneal cavity. And you can get herniation through their pelvis cavity. So you'll get inguinal hernia, is pretty common. You'll also get something right in the middle of the abdomen called a periumbilical hernia, like around the umbilicus, the belly button. And then here's the stomach, and the stomach will herniate upward into the chest. Usually it's a small hiatal hernia, HH, but sometimes it's big. Sometimes I'll see the whole stomach up in the chest. We'll call that an intrathoracic stomach. And then you'll reflux gastric acid up there, and it can cause quite a bit of inflammation, discomfort, gastroesophageal reflux disease, epithelial metaplasia, meaning a change in the lining cells, and that's called a Barrett's esophagus. Typically, it's a pre-malignant lesion, and it's at increased risk of developing esophageal cancer. The back pressure will cause pressure down into the veins of the scrotum in men, and it can cause them to dilate, and it's called a varicocele, the scrotal vein dilatation. That can heat up the testicles and cause infertility. So the point is, constipation can make a man infertile, heating up the testicles with a varicocele. Back pressure into the lower rectum causes rectal hemorrhoids, and those can be unpleasant, can lead to bleeding. Here's the back pressure coming down in the abdomen, pushes on these veins, and that'll cause varicose veins. So a smart move is eat your fiber so you have liquefied stool on the right side of the abdomen. When you defecate, it'll be relatively effortless. You'll be popping out cow patties instead of Tootsie Rolls or goat pellets, and all your abdominal health will be much better. And by the way, I see this stuff all day, every day. Super common. I mean, appendicitis is a little less common. I forgot to mention too, colon cancer is a lot more common in these same patients. So here's the guy with the big beer belly, the estrogen belly, looks like a pregnant female. He thinks calling it beer belly is macho, but actually it's a pretty feminine appearance, looking like a pregnant female. The man boobs are called moobs, and I'll routinely see some gynecomastia in there, meaning, breast development, glandular breast development. So it is not a good look for a guy. All right, so here is two contrasting populations. Here's the Pima, and here's the Tarahumara. They're located in northern Mexico. They initially were kind of co-joined populations. After the Mexican-American War in 1848, the Pima were absorbed into Arizona, and they eat a Western diet these days, so they have all the Western diseases. They're notorious for having tons of gallstones and needing gallbladder surgery, appendicitis, diverticulitis. So I'm showing, here's a drawing of a stereotypical Pima person. They'll have all these surgical scars. Cabbage is coronary artery bypass grafts, which means open heart surgery with a bypass for coronary artery atherosclerosis. Pacemakers are super common nowadays. Thyroidectomy, thyroid disease, sigmoid resection for diverticulitis. A BKA is a below knee amputation in diabetics. Diabetics have a lot of amputations every day in every Western hospital. There's a couple of diabetics getting their toes chopped off, and it can progress and lead to them getting, their ankle amputation almost at the level of the ankle, transmetatarsal amputations. It can lead to below the knee amputations. It can lead to above the knee amputations. Super common stuff. Also, cigarette smoking all makes it worse. Diabetes is especially bad because you get a microvasculopathy down in the small vessels of the foot, and there's nowhere distal to plug into. So the surgeon, what the heck can you do? You can't angioplasty or stent those tiny little arteries in the foot. You can't surgically bypass them because there's no outflow. There's no target to bypass to. So you're basically screwed. You just amputate the toes. Okay, and then in comparison, here's the Tarahumara. Tarahumara are located in northern Mexico, like the Copper Canyon area of the Sierra Madre Mountains. And they're world famous for being ultramarathon runners. Every guy in town, once a year, they got a holiday where they run 100 miles in 2 days. So the average guy can run 100 miles in 2 days. And, other Americans have gone there. Like this guy, I think this is Scott Jurek. Yeah, here's his book, Eat and Run. He's an ultramarathon star. He went and visited the Tarahumara. And there's been other famous people, Ruth Hydrus, the lady who survived metastatic breast cancer. She went and visited the Tarahumara. And there's been other people that have gone and visited them. They're for real, okay? So they live kind of, like I said, Copper Canyon, Sierra Madre Mountains. So they don't have any cars. They just run around a lot. Nathan Pritikin patterned his whole diet after the Tarahumara. The guy, I think it was a guy by the name of Bill Connor in the 1970s, an American scientist, went over there and he tested all their blood tests, their blood lipids, and like none of them had hypertension. And their average total cholesterol, I think in the men was around 136. I'm not sure on that, but it was something in that ballpark. Okay, here's the Pima back in the 1800s. So they were just the same as the Tarahumara. They were real healthy. I mean, these guys look like a college wrestling team. But, you westernized their diet, and now they're all primarily fat and sick. So that's the point. It's the diet. It's every population. It's not like one ethnic group. It's every ethnic group. And any ethnic group that goes from their traditional ways to, Western high-fat diets, they all get fat and sick. Okay, and here's pretty much what it comes down to. You know how you see a map when you walk into some tourist site? And here's the map of your life. Basically, here you are. And basically, if you go down the path of a typical American, your health is basically screwed. All this high-fat, meat, oil diets, processed food diets lead to obesity, hypertension, diabetes, and all the other problems we sort of alluded to earlier. And they don't know what causes them. The doctors just can give you a bunch of drugs, drug. It's pretty routine for, average 60-year-old patient to be on like at least 5, if not 10 or 15 meds. It's super common. Ask anybody that works in a hospital. They'll tell you it's amazing how many pills people take. All right, and the pills don't tend to work very well. So then they start going for surgeries, chop. So basically you're drugged out, then you get chopped up, and this can become very expensive. Bye-bye money. You're prematurely senile, stupefied, and dead. Okay, so that's man's way of approaching health. It's expensive, it's painful, and it doesn't work well. Okay, and this other approach here, I call it God's way of health. It's free. Everybody has to eat, so just eat healthy food. Okay, try to get your sleep, and this usually works. So you want to eat low fat, low sodium, 100% vegan, 100% organic if that's possible. I realize that's not always possible, but then then take a look at I think environmentalworkinggroup.org, the Dirty Dozen, the most commonly herbicide, pesticide sprayed foods, and try to avoid those. Try to avoid the glyphosate stuff if you can. And there's some other things. You want that AP and then EEL. You don't want that stuff. I would never eat an avocado for that reason. So you need to know a little bit about toxins. It's getting more complicated to stay healthy than it used to be. So, it used to be all these sort of like rural areas, the blue zones from National Geographic's of healthy people, Dan Buettner's work and all that. They just ate 95% or more plant-based, and that was enough to be healthy in the past. But I think nowadays it's really useful to also learn something about toxins and avoid them, learn something about EMF and try to decrease that a bit. The other things that are all sort of the pillars of health, if you will, get your sunshine for your vitamin D. It also releases subcutaneous nitric oxide precursors that provide systemic vasodilation. They open up your arteries, they make you feel good. That's why when you walk out in the sun, it feels good. Get some exercise every day. It doesn't have to be anything fancy, but at least do a significant amount of walking. Try to get your sleep, because if you don't get your sleep, it's equivalent of being stressed out. It raises the same hormones as stress. Sleep deprivation does. Do something to help each other, because you help other people. You get reward neurotransmitters released when you help other people. So being nice and helping others doesn't just help them, it also helps you. Try to maintain a social support system, get along with people. Religious people are a lot healthier than other people. And nowadays, it's sort of, our country's kind of moving into what I would call atheistic Darwinism. So they try to pretend religion doesn't matter, but it's actually super important because it gets people to be, what does it mean? Legare, to ligate, to tie together. So it gets people to kind of be a little bit more unified, have more in common, be nicer to each other. You go down this path, your Johnson will probably keep working much longer. You'll have to take very few, if any, pills. Like I said, I'm 60. I don't take any pills. I don't have any medical diseases. And you'll avoid surgery. I've never had surgery. I don't want any surgery. And I call this God's way because it's free and it usually works. Okay. And on average, you'll probably live to about 90. Okay. So that's a pretty good deal. And here it is, about as simple as I can make it. Your body is like buying a sports car or a fancy car. This is a Rolls Royce, whatever it costs. Let's just say it costs, $100,000, $150,000. I don't even know what a Rolls Royce costs. All right. But anyways, that's your body. And the difference, though, is, you might be happy with a car if it lasts you for 20 years. Your body should last you for 90 years, okay? So you got to take care of it. Now, you go to the gas station, and you have to make a choice here. If the dealer says, get premium for your car, all right? Premium gas, and you better put premium gas into it. If you put regular gas into it, it's going to cause all kinds of vague, a little bit unpredictable problems. It's going to plug up the fuel lines and all that. And what I'm saying is, if you're plugging up the arteries of your body because you're eating a high-fat, unhealthy diet and you're deficient in fiber, magnesium, potassium, and antioxidants, you're just going to have all kinds of chronic Western problems. And no medical surgical bullshitology can fix that. There is no pill. There is no surgery that can fix that. What does a surgeon do? They just take out body parts. Take out your gallbladder. We'll take out your appendix. We'll take out your sigmoid colon. Okay. You think that's going to cure you? All right. And what I've described it before, this idea that it's all kind of the same stuff. So this comes from a joke from the movie Colors. Okay. And the story is there's two bulls up on a hill. And there's a young bull and there's an old bull. Okay, so the young bull goes to the old bull. Hey, look at all those cows down there. Look at all those cows down there. Why don't we run down there and have sex with one of those cows? And the old bull says, why don't we walk down there and have sex with all of them? Okay, so the point of the matter is, why take a pill for one disease, a pill that probably doesn't even work, when you can just go low fat, low sodium, vegan, get your sunshine, get your sleep, manage your stress, have a purpose, all this stuff. And probably improve all of them. Okay, that's what I do. Trust me, that's the smartest thing you could do that I'm aware of. I've been a doctor over 30 years, and I studied this stuff pretty much backwards and forwards, trying to understand it as well as possible. And I'll tell you, that's where my thinking is at. That's where the smart move. That's the smart move is try to avoid all of this medical stuff 100%. These blue zone healthiest places in the world. That's what they do. They just live healthy every day. And they don't get too sick. I've seen these Okinawans in their hundreds, 105 years old, doing push-ups. All right. It used to be called Shangri-La, land of the immortals. It lives so long. Here is a diverticulitis. So here's a little outpouching of the wall, these little air bubbles. Here's a little air bubble, diverticulum right here. And then here's where one of them perforated. And you can see normal fat is kind of like the subcutaneous fat. It's kind of relatively uniform in its density. Here's relatively normal fat up here, relatively normal fat over here. And what I'm trying to say is this fat over here, it's very dirty. It's because you got liquid density. CAT scans are all based on density. You basically sit in a machine, it looks like a donut, and the radiation comes out of one side, goes into detectors on the other side as it spins around in a circle. And it plots out the density, it plots out the density of all the tissue. And so this fat has become increased in density because there's all this fluid from inflammation of the mesentery due to a diverticular perforation with diverticulitis, stool leaking into the mesenteric fat. All the fat around the ball is called the mesenteric fat. And so you got inflammation. That's diverticulitis. And it hurts a lot. It hurts a lot. I've known some doctors that had that problem and were admitted it hurts big time. Here's a really good book about Dennis Burkitt, How a Humble Surgeon Changed the World by Ethel Nelson. And there's Dennis Burkitt right there. Dennis Burkitt is a really heroic guy. There's Dennis Burkitt right there. And there were some of his friends that he worked on in figuring out abdominal pressure syndrome. Okay. So I read this book. It's really easy to read. If you want to read a book about Dennis Burkitt, that's a good one. He also wrote some books himself that are good as well. You can watch videos of him on the internet too. But yeah, you want to know about Dennis Burkitt. It's basically abdominal pressure syndrome. I just explained the whole thing to you. Okay. He also was the guy who described what became called Burkitt's lymphoma. And he was in charge of all the epidemiology in Africa. He was a Christian missionary surgeon. He's originally from Ireland, did some of his surgical training in England. Then he went to Africa, and he was there about 20 years. And he figured out abdominal pressure syndrome was his biggest discovery, and that's a pretty big discovery. Okay, so we talked about this already. Cholesterol, gallstones, the main thing here. Fatty liver is just from eating too much dietary fat. Excess dietary fat, especially sat fat, is the most common cause of insulin resistance leading to diabetes. And accumulation of fat in the liver is basically diabetes of the liver. Fatty liver, you can think of it as being diabetes of the liver. Okay, and it leads to fasting hyperglycemia, high blood glucose level in diabetics. Okay, now here's a book that I wrote. Ischemic spine is the most common cause of back pain. How to diagnose it and treat it, by me. All right, so here is the abdominal aorta in front of the lumbar spine. Just for orientation, this would be like sacral vertebra number 1, S1, lumbar vertebra number 5, lumbar vertebra number 4, lumbar vertebra number 3. So L3, L4, L5, and S1 is how we would describe it. Here's the disc space between the vertebrae. And you have a lumbar artery coming off the posterior wall of the abdominal aorta. It gives a small twig down to the end plates. This would be the superior and the inferior end plates of the vertebral body. And then the disc itself does not have any blood vessels. It simply gets its glucose by diffusion from the end plate, and it extrudes its waste product, and those exit the disc by diffusion as well. So when you get atherosclerosis, it's very common to get atherosclerosis, especially along the posterior wall of the abdominal aorta, and this will stenose, but means become narrow or occlude, okay, be fully obstructed, and then you'll get less blood supply to come to these end plates, and this disc will become ischemic, not getting enough oxygen and glucose delivery. It'll fail. Okay, the disc is alive. It runs on anaerobic glycolysis, but it's alive. All right, so here it is again, lumbar artery, and this will stenose or occlude. You'll get diminished blood supply to the end plate, and then over time it'll lead to disc failure. And again, two adjacent discs and the VB, and the disc in between them. Two VBs, vertebral bodies, and the disc between them. That's a spinal segment. Okay, here it says it. L4-5 spinal segment will be L4 and L5 vertebrae, and the disc in between. And that ends up being relevant because you'll get focal segmental instability at the level of the disc when the disc fails. Okay, so the outer part of the disc is called the annulus fibrosus. Here it is, annulus fibrosis. And when it has a lack of blood supply, ischemia, it'll fail, and you get a crack in the annulus fibrosis. We'll call that an annular fissure. It used to be called an annular tear, but they felt that had, timely implications and was sort of a medical legal term, so now they just call it annular fissure. Anyways, the nucleus pulposa is in the center like a jelly donut, which helps, it's sort of gel-like, would help to evenly distribute the waste as the person has position changes. When you get a failure in the annulus fibrosis, the steel-belted radial tire-like material around the outer surface of the disc, the nucleus pulposus will herniate posteriorly, or it can herniate in other locations, but typically posteriorly. And if it's a big herniation, it'll push into the spinal canal and can compress a nerve root. All right, here would be like, you can generally get a flat disc at L5-S1, but this could also just be a failed disc where you have a loss of height compared to the other levels. So when the disc fails, then you have increased weight being borne by the disc above it. And when this one fails, increased weight now has to be borne by the one above it. So the spine is only one trick. And it's kind of like the old Ralph Waldo Emerson quote, the hedgehog is only one trick, but it's the best trick. Okay, the spine is only one trick, but it's a pretty good trick. It lays down calcium from the VB above and the VB below, and they form these bone spurs called osteophytes, and the osteophytes grow together until they fuse in the front. And when you have them at multiple levels, that's called DISH. DISH means D for diffuse, I for idiopathic, S for skeletal, H for hyperostosis. Diffuse idiopathic skeletal hyperostosis. I see this all day long, every day. It's so common. I expect to see it in middle-aged and older patients. Okay, and it's because they've got ischemic degenerative disc disease. All right. There's some other things that can contribute to failure of the spine, and that would include, F- in the water contributes to it because it can damage the collagen. GP glyphosate is also thought to contribute it because it also can damage the collagen. These ligaments are largely made out of collagen as a major component, so that's relevant. Okay, here's a disc herniating under the vertebral body above it. That's called a Schmorl's node. I see those all day long, every day. A disc herniation, when it's flat at the level of the disc space above and below, That's called a protrusion. When the herniation comes out and then starts to go above or below the level of the disc space, that's called an extrusion. And to some extent, it's almost like a little bit of a code word between the neuroradiologist and the surgeon. What you're basically saying with a protrusion is most of the time they're small and they're probably not going to do anything about it. Maybe give the patient a steroid injection. And extrusion, they're more likely, sometimes they are small, but they're more likely to be big and to be pushing significantly on a nerve root or pushing on the dural sac. And these patients are more likely to need surgery. Okay, you can also accumulate abnormal increased amount of fat in the spinal canal. That's called epidural, because the spinal canal is enclosed in something called the dura. So epidura means outside of it, around it. Lipomatosis, fat. And so a lot of patients, if they would just lose weight, they would have less fat in their spinal canal, and it would take some of the pressure off their nerve roots, and their pain might go away. I mean, that's certainly the smart thing to do. Because a lot of patients are obsessed with surgery. Oh, I just need surgery. If only I can get back surgery. I just hope my insurance company will pay for it. They put all their hopes in back surgery, and they don't do anything to improve their own health. What they should be doing is minimizing their atherosclerosis risk factors. Okay, now here's showing like some typical spines. You get atherosclerosis all up and down the aorta. Let's say this is a thoracic aorta, and then coming down here until we get L1 lumbar corresponds in general to the abdominal aorta. You get these lumbar arteries up here. You have intercostal arteries going up. So anyways, you'll just progressively keep failing at every single level of the spine, thoracic spine and lumbar spine. You'll also often fuse across the disc space. This is called an interbody. Inter meaning between, body meaning vertebral bodies, fusion meaning they're stuck together. And what that's all about is you'll have ossification of the disc. It'll calcify initially and then it'll progressively even ossify to fuse the vertebrae, to prevent abnormal motion, to prevent segmental instability. The spine has a lot of proprioceptors. They sense abnormal motion because their job is to protect the central nervous system, like the spinal cord and the brain. And because of that, when they sense abnormal motion at a segment, that's called segmental instability, they'll quickly try to fix it by laying down calcification to fuse those vertebrae. And as soon as you fuse one level, then the above level tends to fail sooner than it otherwise would. So it works its way all the way from the sacrum and the pelvis up to the skull. And what I figured out was that the whole thing is continuous from the lumbar spine up to the skull. So the degenerative disc disease from ischemia in the lumbar spine is related to the dish, and that's also related to OPLL, ossification of the posterior longitudinal ligament, which means to calcify the disc posterior. Like here's an OPLL of the disc. And that also has a lot less common than dish in front or on the side of a vertebral body, but still it works its all the way up to the top. And you can even potentially get fusions of the spinous processes back here. It's called Bastrup's disease. And you can even fuse something in here called the ligamentum flavum. So anyways, it's all related. They've done studies like in Europe where they had to do construction and they dug up these graveyards. And they found the graveyard of the aristocrats are probably eating a lot of meat and high-fat foods and whatnot. They would have a lot of dish, whereas all the poor peasants eating turnips every day, they would not have the dish. Okay, and this just shows the same thing now. So you can see those lumbar arteries, they travel at the mid-height of the vertebral body in this little groove. And so when they fail, it'll fail the disc on that side as well. And you can get this degenerative scoliosis from it. Okay, kidney stones. I briefly mentioned it, but here's a little more on kidney stones. Common spot to lodge is in the UPJ, ureteral pelvic junction, because here's the renal pelvis, here's the ureter. So UPJ. Okay, they can also fail down here, ureter vesicle junction, UVJ. If the stone's 7 millimeters or more, it's less likely to pass. You know, the urologist is going to probably have to fish it out, so to speak. There's lithotripsy tricks they can do. They can also come in the back through something called percutaneous nephrolithotomy. I used to do those procedures in my earlier life before I started mostly doing neuroradiology. I kind of like neuroradiology because it gives me time on, time off. So in my off time, I can do other stuff like make these videos and write books. When I was a surgeon, I was always on call, like every day. Even when I wasn't on call, I did more stuff than the backup guy. So I was still on call even when I wasn't on call. I was on call every day. So it's hard to write or do any creative work when you always have to be around your pager in case it goes off and then you got to go to the hospital. Okay, this is normal gut over here, and here's leaky gut over here. So in a normal gut, it's called the enterocytes because the gut's called the enteric tract. Single cell lining of the intestinal tract, and the cells are held together by TJs, tight junctions. Tight junctions are made from fiber. The way it works is you eat dietary fiber. It goes into the good bacteria. The good bacteria here, I drew them with a smile. They convert the fiber into short-chain fatty acids, SCFA, short-chain fatty acids. The most important one is the 4-carbon, 4C, butyrate. The butyrate is taken by the enterocytes and used to make these tight junctions, and that prevents anything from getting in between the cells. This is a dendritic cell. It's a type of immune system cell. Okay, now all of these things listed here, and there's a whole bunch of them. I don't know. I don't even count them. It looks to me like it's like over 20 of them. They're all associated with causing leaky gut. Most common thing is lack of dietary fiber. Then you got F- in the water. Then you got GP in the non-organic food, and there's a whole bunch of other ones. Okay, so then you'll have a failure of your tight junctions. And now bacteria, these are the bad bacteria. They got a frown. They look kind of angry. Like the gram-negative bad bacteria will produce LPS, lipopolysaccharide. Gram-positive bacteria produce something similar called LTA, lipoteichoic acid. That can get through the tight junctions and get inside the body beyond the gut layer there, and they can cause a lot of inflammation. They can activate something called toll-like receptors. So get this whole cascades of inflammation. In addition, you can absorb big chunks of protein. Normally, you'll only absorb a tripeptide or less, meaning 3 amino acids together or less. When you absorb big chunks of protein, you can get antibodies to form to those. And then because it's coming from a protein of an animal, the amino acid sequence might be similar to our own proteins, and that antibody might cross-react with our own body. So the similarity of sequence is called molecular mimicry. The antibody reacting with our own body is called auto, means against self, autoantibody cross-reactivity. So it'll cross-react and damage, let's say, our thyroid or some other part of our body. Normally, you can only get 3 amino acids through. So if your tight junctions are intact, you'll never have this problem. But without tight junction, you can be screwed. So here's a gram-negative bacteria producing LPS. Here's a gram-positive bacteria producing LTA, lipoteichoic acid, lipopolysaccharide. All right, and those will get into the blood, and they'll make the blood more predisposed to clotting, especially if the person's iron overloaded, then it's significantly worse. Okay, but the clotting happens because they'll take fibrinogen, a basic clotting protein that initially starts out in an alpha helix secondary protein configuration, and it'll then flatten that out. It'll change from alpha helix, like a cylinder, to beta pleated sheet, like a piece of paper, and then can stack up the beta pleated sheets. And the bigger a molecule is, the more likely it is to come out of solution, come out of aqueous water solution that's basically everywhere in our body. And it'll clot, and these clots tend to be called dense matted deposits. They're more difficult for the body to remove, to lyse. So I actually think this is a major cause of disease, increasing your predisposition to clotting, which can give you a heart attack or a stroke. Also, though, viral infections can do this. So viral infections and things related to viral infections can cause this transformation, change in shape of the clotting proteins. This is called an amyloid transformation. So I will call these sometimes amyloid clotting, amyloidogenic clotting. And so I think you're getting my point. A lot of people are worried about the formation of blood clots, and I think this is a major, relatively common, important mechanism of it, is having LPS and LTA or viral infections or viral-related things causing a change from an alpha helix configuration to a beta-pleated sheet with subsequently thrombosis. You get these small little clots with the dense matted deposits configuration, difficult to lyse, meaning difficult to remove by the body, and they can lodge in brain tissue, cause brain fog, decrease cognitive performance. They can lodge, in the heart and potentially decrease the person's energy level. So my attitude is, I sometimes call it, there was a Spanish philosopher named Jose Ortega, and he basically said, you don't really learn something until you're shipwrecked. And what he meant by that was, like, let's say a pre-med goes through a class. Okay, I want to learn. I want to be a doctor. I got to memorize, 1,000 things for the test on Friday. They just forget it, a couple of days after the test because they don't really need that material. On the other hand, when you're scared because you got brain fog that you didn't used to have, you got, shortness of breath with relatively mild exertion compared to before, and you start looking for answers, man, you're going to pay attention. And what I'm telling you is preventing leaky gut, you can help avoid these clots, and that might help significantly. And not being iron overloaded, iron overload can also lead to amyloidogenic clotting. The two researchers who've done the most on this subject are these guy from England is Douglas Kell, PhD. He's a really brilliant guy. And Etheresia Pretorius, she's also super smart. So I'm impressed by their work, and you can just watch them for free. They got YouTube videos, okay? but you want to prevent leaky gut. So here's an example of ulcerative colitis. It's a type of inflammatory bowel disease. And the unique thing about it here is the bowel wall is markedly thickened. As far as like what's a good baseline in the small bowel, see how this right here, that's about how thick the bowel should normally only be, a couple millimeters thick, the wall of it, whereas it's much thicker here. And it's because it's all inflamed. So you're having an immune response there. And you can tell this person has a fatty liver because look at the liver. It's lower in density than the spleen. So the brighter the object, the more dense it is. So fatty liver means the liver normally should be the same or iso with the spleen. And here it's less dense. So this is a fatty liver. Okay. Okay, we already talked about the beer belly guy. Oh, and here's some more of this estrogen stuff. Here is the uterus. Here's the endometrial lining, kind of white stuff. Here's the urine in the urinary bladder. The female uterus sits on top of the urinary bladder. This is looking at her from the side, so it's called a sagittal view. And here's a fibroid growing out of the uterine fundus, the top of the uterus. And when something projects out from the side of a structure, then it's called exophytic. So I would describe this as there's a fundal fibroid projecting cephalatin anterior, approximately 6 by 7 centimeters. All right, so that can cause some discomfort. If it's projecting into the lining of the uterus, then it's more likely to cause abnormal bleeding. Of course, if it's in the myometrium, the muscular layer of the uterus, it can compress the endometrial canal, and that can lead to infertility. Here is a big fibroid uterus, and you can see it's pushing on the urinary bladder. That can make the person have to pee more often. Oh, actually, no, hold on a sec. Hold on a sec. Let me look at this case more carefully. All right. This thing was so giant, it looks like a uterus. This is actually a giant prostate. This is about as big as a prostate as I've ever seen in my life. This is the prostate that ate New York City, okay? And you can tell it's a guy because he's got a Johnson, even though there's jokes about that nowadays that I won't go into. But that was some joke that the fastest growing specialty is, well, I'm not even going to say it in this lecture. All right, but anyways, this is the prostate that ate New York City. It's mongo, it's giant, it's huge. And you can see it's pushing on the urinary bladder. And this is why guys, as they get older, they're more likely to have to wake up to void more often. And it can be a big deal because it can make it hard for them to sleep. So avoid all this estrogenic chemicals so you don't get your prostate growing so big. Here's what estrogen chemistry is all about. It's based on a cholesterol backbone ring. So cholesterol has 4 rings, A, B, C, and D. And a hydroxyl group, OH, also called an alcohol group, comes off the A ring. All right, now here it is when it's an estrogen. Estrogens are unique that the cyclohexene, meaning 6 carbons right here, have 3 double bonds. When there's 3 double bonds, then it's also called a benzene group or an aromatic ring because it has a characteristic pleasant smell. The hydroxyl group here, also called an alcohol group, is antimicrobial. Together, the benzene ring and the hydroxyl group is called a phenol. And it's a great preservative, okay? Because the benzene ring conveys tremendous shelf life stability. If a company sells a product, they don't want it returned to them because they lose money. So they want to have good shelf life stability, meaning it doesn't fall apart. And they want antimicrobial, meaning that mold doesn't grow in the food, fungus. So it's perfect. This is a $1 billion industry making this stuff, so it's never going to go away. They can just change one little substituent on it, even far from the active site. And they're always going to do that because there's too much money at stake. So here you can see the cholesterol type ring. Here's the aromatic ring. Here's the oxygen of the hydroxyl group. And here's a hydrogen being shared between an oxygen in the active site of the amino of the enzyme. And because of that, all it takes is this phenol group, and you will get binding of a chemical to activate estrogen receptors. The estrogen receptor is kind of promiscuous. Evolutionarily, traditionally, there wasn't that much competition before all these modern chemicals came along. So they'll have a tendency to activate the estrogen receptor. All right, and here's a typical example of how it works. Here's BPA, bisphenol A. So bis means 2. It's like 2 phenol groups that are not exactly next to each other. They got intervening 3 carbons here. All right, so anyways, people noticed that BPA was quite toxic. It can cause brain damage. It's very estrogenic, bad for health. This is used in the hard plastic bottles. So the food, and they said, we should ban this chemical. The food company said, okay, fine, you're right. We'll ban the chemical. Whoop-de-doo. So they ban the BPA, and then they make something called BPS. You put a sulfate group in the middle. You still have the phenol groups on both sides of it. And there's other things they can put in the center here. So the point I'm saying is people ask me, well, why don't we write a letter, to the food companies and tell them to stop doing that? And I'm like saying, you're wasting your time, because they're always just going to make some new mild variation of it that's still estrogenic, because it's just too profitable. Okay. It's another reason why I talk about Bible ethics. If you don't have ethics, like I like Ayn Rand's quote that the individual is the smallest minority. If you don't have that, you really don't kind of have anything, because then, Fyodor Dostoevsky, the Russian writer in the 1800s, he said, if there is no God, then everything is permitted, including cannibalism. And so that's what I see. I see that many of these big administrative institutions that are supposedly trying to maintain the safety of the food supply, the safety of the pharmaceuticals, the quality of care and medicine, they're out to lunch. They've been paid off by these big companies, and they don't do anything. Okay, so the individual's on their own. So that's why you want to be as knowledgeable as you can be about this stuff, so you protect your health. And an easy way to protect yourself from a lot of this stuff is to be really simple. When you're simple, you don't need all these personal care products. I told a story before about my wife's bathroom versus my bathroom. In my bathroom, there is nothing but a simple transparent bar of soap, the simplest possible one you can buy. That's it. I don't use shampoo. I don't use any personal care products. In my wife's bathroom, there's like 55, okay? And, I tell her, I said, what are you doing? You're rubbing all this crap on yourself. You don't even know what it is. It's full of estrogenic chemicals and other toxic stuff. And, of course, she goes, oh, you're just jealous. She says, you have wrinkles. You're not aging that well. I'm aging better than her, by the way. No comparison. But she says to me, you've got wrinkles on your face. You look so old. She says, right between your eyebrows, you've got a big bitch line. I think you need Botox. And I'm like, oh, yeah, right. Give me a break. All right. So anyways, here is parabenzoic acid. The parabenzoic stuff is just a nomenclature for where it is opposite of this carboxylic acid. Okay. But so power position is to be directly opposite. And that's a typical, pretty good preservative. And that's in some paraben or some variant similar to it. It's in all the personal care products. Many of them have multiple of these things, okay, to prevent fungal growth. And another point I'd like to make is fungal inhibitors are often anti-mitochondrial. So they're often mitochondrial inhibitors. They'll decrease energy production in those cells. And in the brain cells, they're neurotoxic, okay? So there was a guy, I think his name was Seralini, and he showed that he actually said these estrogenic chemicals should be renamed. They typically were called EDCs, for endocrine disrupting chemicals, or estrogen disrupting chemicals. He said they should be called ENDCs, endocrine and neurologic disrupting chemicals, because they're very routinely neurotoxic. And, again, the food company doesn't want self-return, so they put fungal inhibitors in there. But fungal inhibitors are often mitochondrial inhibitors, so that's bad. You need mitochondrial functioning well to have a brain function well, and also detoxify the brain when toxins get into the brain. Okay, parabens can also interfere with thyroid function. So to me, the only answer is stop using all these personal care products. I can tell you, like women, you don't need deodorant, okay? We either like you or we don't. We can't even help it. We like women, men like women, a lot more than women like men. I think it was at the what do you call those personal sites or dating sites. It was like they asked the men a questionnaire, and they thought about 85% of the women were reasonably attractive. The women thought only the opposite. Only 15% of the men were reasonably attractive, okay? So men like women a lot more. And what I'm trying to say is I've had about 1 million conversations in my life with guys about women. Never once has any guy said, I would not sleep with her because she smells bad. They just don't say that, okay? And believe me, they say a lot of things. So it's a non-issue. When you walk in a room, you say, hey, how you doing? You don't sniff each other's armpits. We're not like dogs. We don't smell each other. So that's really not an issue. And for example, I don't have much hair, and I got my haircut like I just told you. But even without my haircut, I don't have that much hair. But I don't use shampoo. I find it didn't make any difference. So why bother with it? I don't wear any cologne, none of this crap. I don't even put laundry detergent on my laundry. I just do it in hot water. Run it a little hotter, a little longer, dry a little longer. That works fine. Okay, here's a big thing that you probably never heard of, and it's real important to know. The body excretes estrogen through the liver. The estrogen comes into the liver, and it gets hydroxylated, making it a little more soluble in the bile. Bile is a bit water-like. People think bile is all fat. No, it's also kind of water-like. So they'll hydroxylate it, put in an OH group on there, and then they're going to conjugate it with what's called a glucuronic acid. Think of it just being like a glucose with a carboxylic acid attached to it. And the bottom line is that is excreted. So here's the E for estrogen. Here's the conjugation of the glucuronic acid. It's then excreted by the liver into the bile, into the biliary system, and then that goes into the duodenum, the small bowel. And normally we would defecate it out. We would poop it into our stool, and that's how our body would get rid of estrogen. However, what happens is, and the good gut bacteria facilitate that process from happening. They are your friend. They are symbiotic with us, meaning that they want to live in our colon and our small bowel a little bit, but especially our colon, and they are happy to be there, and they do good things to help us. They're like a tenant that wants to live in your apartment building of your colon. Versus the bad bacteria, like that come from eating meat and processed food, they don't give an SHIT whether or not you live or die. They could care less, and they have more of an enzyme called glucuronidase. So this glucuronidase cleaves the glucuronic acid off the estrogen, and once they're separated, so here's the glucuronic acid, here's the estrogen separate, the estrogen will be now reabsorbed into the body, going to the blood. So people who are deficient in fiber, they will have increased estrogen levels in the blood, and that'll predispose them to premenopausal syndrome, to fibroids, to breast cancer, uterine cancer, and in the men, the prostate cancer. I've had some women tell me every single woman in their family had to get a hysterectomy for fibroids before she was 35 years of age. And that causes a dramatic increase in the risk of congestive heart failure, of coronary artery disease, of stroke, of dementia. Mayo Clinic did a study on like 2,000 of them. Okay. And I've seen it. Like when I look at a brain demented female, let's say in the ballpark of 55 to 65, first of all, I look for the usual suspects. You know, is she a drug addict? Is she an alcoholic or something like that? And whenever there's no obvious answer, it's usually because she had a hysterectomy at a young age. Okay, what's the difference in the healing ability between somebody who knows nutrition, epidemiology, toxicity versus not knowing? It's the difference between being a Gulliver or a Lilliputian, okay? And I kind of laugh, too, about Luther's quote about the Bible. Luther said, a peasant with scripture knows more than a pope without scripture. And so what I'm basically saying is you can have somebody who just decided to be a health coach and started studying this stuff, and they're going to know far more useful information than some doctor who's been a doctor for 30 years and did 2 fellowships, because that's where it's at. Nutrition, epidemiology, and toxicology. We talk about nutrition. Epidemiology is being aware of population health, because you just look at the healthy populations and say what's unique about them, like the Blue Zone study and all the other migration studies. And then toxicology. Toxicology is sort of like the hot new topic. That's emerging as new. And then EMF is becoming a bigger subject too. So those are all related. So NET can also be NEAT, N-E-E-T, nutrition, epidemiology, EMF, and toxicology. Okay. And basically, you can be a Gulliver and know this stuff and really help people and help yourself. Or you can be a typical Lilliputian and do a whole bunch of ignorant, passive-aggressive stuff and not really accomplish much useful stuff. Okay. So it's kind of a cool painting. I always liked Jonathan Swift. This is the painting over here, Gulliver and the Lilliputians. Oh, what I thought was funny about the painting too was, you know, poor Gulliver, they're tying him down. And that's what I think conventional medicine does too. It ties down the Gullivers, okay? You know, conventional medicine, I got a lot of doctor friends that come, they ask me to help them with their personal problems, their family, their friends, but they don't ever ask me to speak in front of their group because they know all this vegan stuff, it's not profitable. Selling drugs is profitable. Selling surgeries is profitable. So they want to kind of keep the wraps on this knowledge. Okay, it's pretty simple. Here I call this the Spartan vegan diet, and I kind of jokingly call it now with my monk haircut, the medical monk diet. Okay, it's the same thing. Basically, there's only 3 types of good foods, in my opinion. You eat your starches, satisfy your hunger with that for the most part. You can supplement that with some fruits, and then eat some veggies, get your nitrates, some more greens. Take vitamin B12, methylcobalamin. Now, don't get me wrong. I know a lot of people are pretty fancy. They love all these spices and all that stuff. And go ahead and do all that stuff. If it makes you happy, go ahead. But my personal style is, you know, I work a lot of hours. I'm kind of tired. I just want to eat fast. And so I try to keep things simple. And I usually have somebody cooking for me. But I try to keep everything very simple because that's how I'm able to work so much and do so much of the things that I like doing, like write books, is because everything else in my life is super simple. And then here's just sort of like the cornerstones of the social components, your exercise, your sleep, your sunshine, your religion, your family, friends, and stress management and all that stuff. So it's pretty basic, you know, it's not rocket science. Anybody can learn this. The hard part a lot of time is unlearning all the nonsense you heard when you were young, you know, thinking you need to eat meat, you need to get more iron. That's all nonsense. So that's basically what I got. That's it.
Wow. Click like for Dr. Rogers or give him a heart because this was just absolutely enlightening and just full of so much information. I'm sure the Green Moors are going to agree with me. We're going to have to watch this again. It's just lots and lots of excellent information. You just want to take screenshots and take notes and share it with so many people. And I hope that the Green Warriors will do that. Let's just take a look and see if we have any comments or questions that came in. Oh, Kerry said, "Love your work, Dr. Rogers." So
Thank
you
you.
have you have a fan club growing out there. And Kerry's looking for a study showing how dairy proteins fit into opioid receptors. So I don't know if you know of a study like that. I think she's interested in that.
Actually,
So
I think I know what she's getting at. Basically, there's something called casomorphines. So think of caso being like cheese, morphine being morphine-like, opioid-like. And the gist of it is, my understanding of it is, the casomorphines are in there to get the baby to like the milk and to drink the milk, and afterwards to be able to take a nap. And so when the baby takes a nap, that gives mama some rest. And so that's why it's in milk. All right. But the relevance is it can be a little concentrated when a person eats cheese, the casomorphines, if you will. So some people just love eating cheese. They almost get kind of emotional about it. Oh, I love cheese. I don't mind quitting milk, but how could I quit cheese? They love it so much. I'm like, it's because you're becoming a morphine addict, okay? That's partly why it's so pleasant. They concentrate it. And cheese also has concentrated estrogen. So that's what it's about. That's how dairy is associated with morphine.
yeah, I would assume that the probably different concentrations even in cow's milk versus human milk.
Yeah, I know the protein levels are very different, and I don't know exactly how much casomorphines are in cow versus human milk, but in general, cow milk, humans are designed to drink human milk. Human milk only has about 5-6% protein. Cow milk has a lot more because baby cow, a calf can gain 500 pounds or something in a year, whereas a regular baby is not going to gain anywhere near that much weight.
Yeah, absolutely. Okay, thank you for that. So Steve Valley wanted to know, can IBS, can it be cured in any
Okay, but
way?
that I think you mean irritable bowel
Yeah.
syndrome.
Mm-hmm.
I would expect that you could, because you can. I think what happens with a lot of people is they eat a mixed diet. And the typical person, in my experience, you tell them to go 100% vegan. They go, I don't know if I'm ready for that. They go, well, I'm cutting down on meat. I'm cutting down on meat. And what I'm getting at is in your colon, there's like a battle between call them the good gut bacteria that feed on fiber versus the bad gut bacteria that survive in the environment of a meat-based diet, oil-based diet, processed food diet. So what I'm saying is if you say you're cutting down, you're typically eating a combination of meat, oil, dairy, both of these things. And so those bacteria are constantly fighting. It's like a gang war. They're fighting for turf. And that fight never stops as long as you're eating both. Once you go 100% vegan, what you'll see happen, starch-based vegan diet, fruits are really good as well. Your gut just calms down. The first 2 weeks or so of the transition, you can have the farts quite a bit and bloating. But once your gut population stabilizes, I actually think there's only 2 worthwhile bacterial populations worth understanding. Excuse me. There's the good ones, and that's based on eating a plant-based diet and the fiber. That feeds good bacteria. And then there's the bad ones. That's based on having a shortage of dietary fiber plus all these toxins I showed you before that cause leaky gut. So you want to do all the stuff that prevents leaky gut and gives you fiber so you get the good gut bacteria, and there's a good chance the gut will calm down because the same populations that eat and live this way, they hardly ever get autoimmune diseases. And I sort of think of IBS as being sort of related to, like Crohn's and ulcerative colitis, those being more severe. But you'd have a good chance to go down that path. There's some people who know more about this stuff. Like there's this one guy, he's pretty good. What's his name? He's a gastroenterologist. He wrote a book called Fiber Fueled.
Dr. Will Bolsevitz. He's been on the show a couple of times.
Yeah. You can check out his interview appearance with the show, and he'll know more about it. But I can tell you, it's pretty common. People used to have diarrhea, bloating, abdominal discomfort, the burps, the farts, etc., and they go all 100% vegan, and it just calms down, and they are improved a lot, if not cured. For me, for example, I had a sort of a mild IBS. It all went away.
Mm-hmm. Yeah, that's a great answer. And I've interviewed a few gastroenterologists who were promoting the plant-based lifestyle, and a lot of them had talked about how sometimes people with these issues can be more sensitive to the fiber because they haven't been used to consuming it, and how important it is to really chew your food to a cream so it can be more easily digested, at least at first, to do that, to help allay some of maybe the gassy feeling that you may get from some of the fiber foods. Oh, Gina said, Dr. Rogers always goes deep into science. I just love the hand drawings and the connections to the beautiful masterpieces. Yes.
Yeah, well, thank you.
I agree. And Stacy said, no deodorant in 5 years. Started as a bet.
Good. Yeah, and I was also just say, just regarding that last comment, I have a philosophical approach to learning and believe that, there's sort of this attitude that's taught in grade schools, high school, colleges, even grad schools, that learning is discipline and you have to discipline yourself and you have to work hard and study. But I think that's to some extent BS. And what I mean by that is when you're learning things that you want to learn about, it's enjoyable, it's pleasant. And, and you can remember back to conversations with your mother and father when you would ask them stuff and they would talk to you. It's an enjoyable thing. And so what I'm trying to say is by presenting it and focusing on things that actually really matter and are useful to you, it just works naturally to include art and philosophy in there. They all kind of go together. Okay. And so I see that as a natural, true learning. So true learning is to learn things we care about that's self-directed versus a lot of school is more like it's imposed upon you. The teacher says you got to know these, 50 things for the test on Friday, but most of that stuff's all forgotten. Whereas when you learn something because you want to know, oh, okay, high fiber diet will help protect my gut. It'll help, prevent leaky gut, protect me from autoimmune disease. The fiber also prevents leaky blood-brain barrier. That's useful information. You remember that the rest of your life.
Yep. And it would also be helpful to share broadcasts like this with people that you know and then have discussions about them so that you can both learn from repeating the things that you've been trying to absorb. I think that can be helpful. And you talk about that because you've written so many different books and you have a book on how to learn and how to score high on tests. And that's one of the tips that you gave. So Chris said, is it okay to eat small quantities of mollusks like oysters or scallops?
I wouldn't do it. I mean, because and this is also, we're going to get into a little bit of philosophy here, but I believe if you want to be good or excellent at anything, you have to get into philosophy. Okay. There's no way around it. Okay. And I think Ayn Rand had a good quote about that. He says, you need a philosophy in order to make judgments. You need judgments in order to make decisions. And that leads to what you do, your behavior. And you can't escape that. The only way you can escape that is if you simply accept the sort of philosophy that is imposed upon you by the external world. And that's usually not going to be made in your favor. So what am I trying to say is my goal with health is to be as healthy as possible, to have as optimal a cognitive function as possible. I want the best I can possibly do, which means that I don't want to do anything that I think is detrimental to health. And I put that in contrast to most people in my personal experience. They say, I'm doing okay. I'm doing okay. And sort of what they mean by that is they're not as fat as their cousin, their local group they hang around. They're doing a little bit better than everybody else. But what I'm trying to say is it's pretty much inevitable for most Americans to be fat, sick, and stupid by the time they're 60 if they continue down this path of high-fat diets, high-meat diets, lack of exercise, TV, cell phone up to the head all the time, all these things. So what I'm saying is the natural path of following the herd is to have terrible consequences. So you should be individualistic and sort of say, well, I'm not going to do anything that's bad for me. Like my attitude about these like filter feeding things on the bottom of the ocean. The ocean is a sewer. It's a garbage dump, okay? There's all these toxic chemicals that bioaccumulate in these filter feeders. So you're ingesting all that stuff. I wouldn't do it.
Yeah, I agree. It's not the same ocean as it used to be, that's for sure. And like you said earlier, the longer that you've been eating the standard American diet, the more you have to really go 100% and eliminate these foods because there's so much damage that can already be done. And just because you're not feeling it doesn't mean that it's not actually happening. So I wanted to ask you a question, Dr. Rogers, and it's more for the benefit of everybody that's watching today. You had discussed in the presentation how fat exerts pressure on spinal nerves. And I think about how people think I'm fat, I need to lose weight, and they point to their belly or maybe their thighs, and they think that that's where when they gain weight and get fat in their body, that's where it all goes. And you kind of alluded to the with the exerting pressure on the spinal cord and about the visceral fat. So
I think I know where you're going with this. It
yeah.
sounds to me like you're talking about something called idiopathic intracranial hypertension and one of the theories of it. So one of the theories of idiopathic intracranial hypertension is that as a person gets fatter, they get a big belly. Let's say from a side view, that their belly, the big fat belly, pushes posteriorly downward on their inferior vena cava. So your inferior vena cava runs on the right side of your body up to the heart. So the iliacs come in the pelvis, inferior vena cava goes up to the heart. And then right from in the right atrium, above it is the superior vena cava. So the pressure of a big fat belly pushing down on there is transmitted in part to the superior vena cava, then up to the brain. So you can get intracranial venous hypertension. And it's especially common in fat people that get something called idiopathic intracranial venous hypertension. And there's a theory that this could be related to fibromyalgia, meaning that the increased intracranial pressure has these positional effects where pressure is increased and it pushes on the nerve root sleeves as they exit the spinal column, and that can cause these vague fibromyalgia-like pains that sort of wax and wane. And so, yeah, it's bad to be fat. Being fat is so common, people think it's normal. But, thinner people, they live longer, they live healthier, they're less likely to be cognitive impaired, less likely to be diabetic, less likely to be hypertensive, less likely to, get atherosclerosis, coronary artery disease, atrial fibrillation, all these problems. So, and the best way to be skinny is eat a low-fat plant-based diet. The lower the percentage of calories from fat, the skinnier the population. Rice, white rice, potatoes, sweet potatoes, they all have 1% of calories from fat. You want to be skinny? Eat a lot of that stuff. That's more important. Exercise helps a little bit, but not much, because the more you exercise, the higher your appetite goes. But when you have a set point in your hypothalamus, like your arcuate nucleus, so the more you have to change your diet in order to change the set point. It's like a thermostat in your brain, your hypothalamus. So that's what you do. You want to be skinny? Eat what skinny people do. That's what skinny people eat.
Okay, Joan has a question. I think you talked about in the presentation, but you may have missed it. How many bowel movements should one have per day?
I would say on average, you probably should be having about 2 or 3 a day. But it's also, the bowel, like it's like your rectum's like intelligent. Okay, it's like, okay, she's got a busy day today. Okay, no time for taking a dump right now. And so, while you're a little bit stressed out and busy, let's say, and you have to get to work early, you'll maybe skip the bowel movement in the morning. And then when you come home, as soon as you're running your house, your colon's like, we're home now. Can I go? So you're gonna have to undress real fast. Okay, and then usually what's going to happen, you're going to eat dinner, and then you should pop out a second one, would be a typical plant-based eater, and when you have the day off, you're even more relaxed and say, hey, maybe we got a little catching up to do, and you'll have maybe 3 or 4 of them, okay? Versus somebody eating a very low-fiber diet and a lot of meat and oils and processed food, they're going to have bowel movements less often and, like we said, be constipated.
Okay, well, very good. So this way people know that it's not regimented, that you have to have exactly a certain number, or that it can vary depending upon your activities and stress level. Okay, let's just see. I think I have one here. Yeah, okay. So James said, I am whole food plant-based and do not have constipation. I have GERD. Could anything else be causing this?
Yeah, there's some foods that'll have a tendency to irritate that. Caffeine tends to make that worse. And then caffeine equivalents, things like being sleep deprived, taking corticosteroid medications, nonsteroidal and auto-inflammatory drugs, the NSAIDs, things like Motrin, ibuprofen, taking aspirin. And there's other things that'll have a tendency to do that too. You can look up a list of them. And you'll notice from your own experience, and you want to avoid those things. Another thing, too, is like whenever I sleep, as soon as I sleep, I always lay right side down. The reason is if you look at your stomach, look at a picture of a stomach. The stomach has the esophagus, connects to the chest. Food goes into the stomach, and then it empties to your right side. So as soon as you lay down on the pillow at night, especially, you ate a big dinner, you want to lay right side down because that way your stomach naturally empties. You don't want to be left side down because you'll have increased tendency to reflux. And also, when you lay right side down, the food's going into the distal part of the stomach, so it's farther from the esophagus. Here's how your stomach goes. Here's distal stomach, the antrum, for example, the pylorus, duodenum over here, and then it has to go all the way back up into the fundus before it gets in the esophagus. So you're keeping the food away from the esophagus. And it's good if you can eat a little earlier, stay upright for a couple hours, like 3 hours or 4 hours after you eat. Those are all things that can help reduce the GERD. But I think, too, you'll find there's also some foods that tend to open up the lower esophageal sphincter. And I don't remember that stuff. I don't deal with this on a daily basis, lower esophageal sphincter type stuff. But you should look up a list of what tends to open up lower esophageal sphincter and avoid those foods, because opening up the lower esophageal sphincter means that the gastric acid can get up into the esophagus and cause, the heartburn, discomfort associated with GERD.
Well, that's a good tip, because I was not aware of that. So that's a very good tip. It's good to know. And because I was thinking that there could be maybe foods that would seem benign that could maybe be causing this, or maybe somebody has some kind of a food allergy or a food intolerance or something, that maybe that could be it too. Karen said, love this doctor, tells it like it is. Yes, we love him too. And that's why we try to have him on about once every month. And he's been on the broadcast before and covered many wonderful topics. And we'll have a playlist just dedicated to Dr. Rogers. So if you go on my YouTube channel, you can look for the playlist that says Dr. Rogers, and you will see all the different presentations and interviews that we've had the pleasure of having him with us. And I wanted to mention again that, did you want to say something, Doctor?
Yeah, I want to say one more thing too, because what a lot of people do is like, oh, I got GERD, and they'll just start taking a pill. And I want to say you want to be careful about that, because some of these pills can have a lot of side effects, like proton pump inhibitors. They're associated with increased atherosclerosis. They're associated with increased dementia. So you don't want to be lazy and always immediately go to a pill. Sometimes you need to take a pill. Okay, nothing else is working, fine. But what you get my point. My point is, always the smart move is, can I fix this myself through a change in diet or behavior or something? Because that usually will get you an optimal fix with no side effects. With a pill, there's almost always some type of side effect.
Yeah. And are some of them addictive?
I don't know for sure about that, but what I'd be scared of is dementia. Okay. Because like one of the things I do is I read a lot of brain MRIs, and I can tell you, I see more demented people now by far than what I used to see. It's nonstop. Demented. Old guy fell, hit head. Memory problems, cognitive impairment, mental status changes, nonstop all day long. Okay, so I've seen a lot more. I sort of look at my brain to spine ratio. I'm seeing more brains than I used to for cognitive impairment. Compared to like sort of in my earlier days, I saw a lot of spines, kind of boring, almost put me to sleep. Nonstop back pain, and I still see lots of back pain, but I'm seeing more and more cognitive impairment than I used to, and there's a lot of reasons for that. And I also alluded to one of them. I think that's an under-recognized problem, that leaky gut, not necessarily causing an autoimmune disease, but making the blood more prothrombotic. Okay, and that's also a post-viral thing, and it's under-recognized. and Kellen Pretorius are the two big researchers on that. They actually have a YouTube talk. Douglas Kell, he's a bright guy. Okay. And you'll see a lot of scientists, I like him. I think the guy's brilliant. Okay, but he's kind of fat. And I'm kind of joking about that, because you often see that in PhDs. They're absolutely brilliant. I think the guy's a genius in what he does. Okay, but they don't know about nutrition. Like with Mike Merzenich, the cochlear implant guy, he's a brilliant genius of his own work, but he's all fat. So what I'm trying to say, I'm not trying to be mean or anything. I'm just stating a fact. And I think that's a lot of times why these PhDs, they can't put it all together, because they're like brilliant in their own little silo of knowledge, but they don't have the big picture to put it all together. And I actually think that's one of the things that I'm really good at doing. Okay, I just wish I had more time, because I'm still working full time as a clinic doctor. But I wish I was at a research institute and I could just study all the time, because I could figure out a lot more things too than what I got time for.
Yes, and you've been coming up with your own theories, and you've been coming up with a lot of great information for us. And somehow you find time to do these broadcasts and write all these wonderful books that you're writing. And again, I wanted to tell the Green Warriors that we're having a book giveaway, and that's for Dr. Rogers' book, The Medical Reformation Vegan Renaissance Bible. And go ahead, and there's going to be a link after the show that you can go to that will help you to find out how you can have up to 6 ways to enter to win this. And if you don't win, I think you should get it anyway, because it's got a lot of, goes even deeper than what he's been touching on today. And Green Warriors, why don't you go ahead and show your appreciation for what Dr. Rogers shared with us today, and just click like. That's how we applaud here. And Dr. Rogers, tell us about how we can find you on social media and so forth.
Oh yeah, I got a YouTube channel. I try to release videos, pretty often. I'm going to try to make every chapter of the book free, because the book, I kind of screwed up with the book in the sense that there's a lot of formatting issues. It's self-published. I don't have time. I've published a bunch of books with regular publishers in the past, but it's too time-consuming because I work full-time. So I just basically see a couple days off, and then, boom, I crank stuff out really fast. So what I'm saying here is, for example, the maximum file size is 650 megabytes. Maximum page number is 830. But then if you try to make a cheaper version, like I wanted to make an expensive version on the highest quality printed paper, because that's the main thing about the book. I got tons and tons of illustrations and pictures in it on every page practically. And I wanted to get all my drawings in there. But when I tried to make a cheaper version on the not so expensive premium paper, like JPEG all the pictures so they're smaller file sizes, then I would have to reduce the page number to 600. So what I'm trying to say is the book's a little expensive. It costs like about $100. But if you want to learn the material, you can just watch the videos for free at my YouTube channel. You can hit the print screen button and save the key images that are useful to you. You can do it that way. You can also buy the book and read and listen along while I give the lectures. So either way, I'm sort of like empowering the pros. Here's a chance to learn all this stuff. And like I said, too, I kind of enjoy doing it. I sort of feel like it's my destiny. You know, I'm getting old. What the heck else am I going to do? My kids are grown up. My wife works all the time. So I just make these videos. And like I said, I sort of feel like I'm fulfilling my destiny. I know that I understand this stuff as well or better than anybody in the world. And it's my hobby. So anyways, that's pretty much it.
Well, thank you for sharing all those things with us, and we surely appreciate it. And I'm really looking forward to having you back on the show because you have a lot more to say about health and what we can do to be empowered. And I really want to thank you, Dr. Rogers, for your insightful and comprehensive explanation of the intricate dynamics of abdominal health and enlightening us with invaluable knowledge to empower our journey towards well-being. And Green Warriors, please click like to show your appreciation. I see some of you are applauding as well. And I wanted to ask the Green Warriors to listen to this because Dr. Rogers usually has some profound things to say. And I wanted to ask you, Dr. Rogers, what is your final take-home message for our Green Warriors?
Well, like I said, too, you know, if you do what the rest of the herd does, you're going to end up fat, sick, and stupid. It's inevitable. You know, like they say, if you feed herbivore animals a high-fat diet, they all get atherosclerosis, 100% of them. That's why I think a lot of these things like coronary artery calcium scan for heart disease, atherosclerosis, it's stupid. You already know you got atherosclerosis if you ate a Western diet, okay? Don't be going looking to figure out if you have it. You have it. So simply just don't let it progress. If you eat the low-fat vegan diet, then it doesn't progress. So just do the smart thing and fix the problem. Patients love going for all these tests. Oh, I'm going for my CAT scan today. Oh, I'm getting a tube up my butt today. Oh, I'm doing this. And okay, gee, that's nice. But if you want to prevent disease, what it really comes down to is what's your diet, what's your lifestyle, your sleep, your stress management. So get all that stuff good. And, you know, if you have to go for a test, fine. But like I said, at every Western hospital in the whole Western world, there'll be 1,000 patients in line for the latest invasive test or something, and there'll be nobody in line or one person to go low-fat vegan and whatnot, okay? And sort of like do the stuff that matters, okay?
Yep, very true, very true. And I think that this is what's giving them the motivation to go ahead and try it or tweak it up a little bit and go 100%, which is what I would recommend. And Green Warrior, tell us what you're going to remember from this broadcast today. One of my takeaways is that back pressure, if transmitted on a chronic basis, can blow out some of the veins and cause varicose veins. Just mind-blowing as well as vein-blowing, I guess. And I also wanted to thank Jess Tess Voice. She did the countdown. She did the promo. And Jess Tess Voice, tell us who's coming up next.
Conquer diabetes and reclaim your health. Confused about whether it's okay to indulge in fruits or wary of carbs? Dr. Scott Harrington will unravel the secrets of combating diabetes through the incredible power of a whole food plant-based lifestyle. Tune in and join the conversation on Wednesday, April 24th, 7 p.m. Eastern, 4 p.m. Pacific on Be Green with Amy Live.
Well, thank you, Green Warrior, for joining us today. Your engagement and support make these discussions meaningful and impactful. And I hope you're feeling inspired to take a closer look at your food choices and make some positive changes for your health and well-being. Remember, every bite we take is an opportunity to nourish our bodies and become the healthiest versions of ourselves. And stay tuned for more empowering content. Subscribe so that you will know when Dr. Rogers is coming back, because he is. And share my message with others who can benefit, because together as Green Warriors, we can make a meaningful difference in the world. And as a special thank you to all of you, I am offering you 5 free recipes. And all you have to do is go to my website, begreenwithamy.com/join, and I will send you those recipes, and you can start enjoying delicious, whole food, plant-based, no added sugar or salt recipes that will become favorites of yours as they are of mine. And if you want to join me with Dr. Rogers, because he's going to help me say my tagline, the end of it, and you guys can type it in the comments and join us and do that. Are you ready, Dr. Rogers? Okay. Until I see all of you again, remember, be strong, be well, and be
green.
green. Thank you so much, Dr. Rogers. Once again, just invaluable information. Really appreciate it. Bye, Green Warriors. Thanks for coming.
Looking for really tasty recipes that are SOS free? No sugar, oil, or salt. How can it taste good? Well, if you like flavor, then you'll love this Be Green with Amy recipe ebook. Get your copy today. Click on the link in the show notes. Be strong, be well, and be green.